the risk factors for sleep apnea. When you see your doctor may look in the back of your throat to take a look at the relative crowdedness of the airway. And this is called a Mallampati score. And most people are scored as either a 1, 2, 3, or 4. For comparison, on the left here, you see a Mallampati score 2, where you can see the uvula, which is the area that hangs in the back of the throat. But you can see the relative opening of the airway versus a Mallampati score 4, where it's just a wall of tissue. You don't see the uvula at all. And sometimes it's so crowded, you can actually see teeth impressions along the side of the tongue. So the biggest risk factor is genetic. And again, an indirect measure of the genetics is not only a family history of sleep apnea, but also just looking at the airway. The Mallampati score, again, is an indirect indicator of one of the genetic risks for sleep apnea. You either have a tight airway or you don't. Other risk factors include weight gain, which crowds the belly and the airway, age, which is everyone's risk factor, being a man is an independent risk factor, as well as menopause status for women. Medical issues are a big risk factor. If you have certain medical issues like hypertension or diabetes, it implies that your weight gain is in the central core region, which also affects sleep apnea. And certain medications can make sleep apnea worse as well. Any of these risk factors in isolation or in combination increases the risk for development of sleep apnea, which can then manifest as symptoms of snoring, pauses in breathing, and daytime dysfunction.